During the procedure, it is essential that gloves are worn to prevent contamination of both operator and machine. And don't forget hand washing.
Proper hand washing technique must always be followed before preparing the transducer and after the procedure. Hands should be washed using soap and warm running water. Begin with hands pointing down. Rub hands vigorously during washing for at least 20 seconds. First, palm to palm. Second, right palm over left dorsum and left palm over right dorsum. Third, palm to palm, fingers interlaced. Fourth, backs of fingers to opposing palms with fingers interlocked. Fifth, rotational rubbing of right thumb clasped in left palm and vice versa. Sixth, rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. This forces soap and water under fingernails. Don't forget to include wrists. Dry hands well using paper towels. Turn off faucet with the towel. Once the study is over, remove the cover. The cover should be disposed of as biohazard trash or as required by your facility. The transducer should be cleaned with soap and water, removing all gel and gross contamination. If necessary, a small brush may be used to clean the crevices of the transducer. Rinse and dry the transducer.
So, now that you've seen how to apply a transducer cover and dispose of it following the exam, let's review some terminology. The terms clean, high-level disinfection, and sterilization are oftentimes confused. It is recommended that users follow the FDA-issued guidelines for reprocessing ultrasound transducer assemblies. You must also follow the manufacturer guidelines for the ultrasound system you are using. Every manufacturer has requirements and limitations on what materials may be used on the transducer.
To clean something is the physical removal of debris. We clean the transducer by thoroughly washing it with soap and water, and any spray or wipes recommended by your transducer manufacturer. High-level disinfection, by comparison, is the destruction of most microbes, including bacteria, viruses, and fungi. Even with high-level disinfection, bacterial spores may not be killed. The AIUM recommends use of high-level disinfection for endocavitary ultrasound transducers. The transducer should soak for the requisite amount of time for disinfection to occur. It is important to always follow the manufacturer guidelines for preparing and using the disinfection solution. It is also imperative to refer to your system manual for approved and compatible solutions for disinfecting your transducer. Personal protection equipment, PPEs such as hand and eye protection, should be worn while working with these solutions, and the solution should be stored in a well-ventilated room or in a device with a vapor management system. Follow your facility's guidelines to ensure proper storage. When we use the term sterilized, it implies that all microbial life, including spores, are killed by the process. No living organisms should remain after sterilization.
It is important to note that transducer materials can be negatively affected by temperatures typically used during heat sterilization. Transducers are not heat stable. At high temperatures, the transducer's piezoelectric material can depolarize. Depolarization means that the transducer no longer has the ability to convert electricity into sound, its essential role. Even in cases where the PZT does not completely depolarize, the crystal's performance may degrade, a process sometimes called aging. Another practical issue is the effect of heat upon the epoxy-like materials found in the backing material, matching layer, and bonding agents. During exposure to elevated temperatures, these materials may soften and then re-harden in deformed states during cooling. As a result, alternate methods of infection control should be considered.
The transducer may then be placed in a clean but not sterile environment, such as a transducer rack or on the ultrasound system.
Appropriate cleaning and disinfection of the ultrasound equipment is essential, especially when invasive procedures are being performed. Always follow FDA and AIUM guidelines, as well as manufacturer recommendations, and always follow the manufacturer guidelines for the disinfecting solution you are using.
As with any process, things can go wrong during a procedure. One problem that could be encountered is selecting the incorrect transducer cover for the procedure being performed. Transducer covers are designed to fit a wide array of transducers. It is important to make sure your cover is the proper material, width, and length to fit your transducer. Another potential problem is the inadvertent puncture of the transducer cover during an exam. While transducer covers are durable and designed to handle a substantial level of wear and tear, it is possible to puncture the cover. It must be assumed that the cover is then contaminated with blood or body fluids and must be thoroughly cleaned of any gross contamination before being placed into the disinfection solution. If the exam is not complete at the time the sterile barrier is compromised, the transducer should not be used until properly recovered. A third potential problem that could be encountered is improperly cleaning, disinfecting, or sterilizing the transducer after use. Using a transducer cover at all time allows a barrier to be established, thus promoting patient and staff safety.
To summarize what we have reviewed in this presentation, for ultrasound scanning, the proper use of barrier protection and the cleaning, disinfecting, and sterilization of ultrasound equipment is essential to reduce the risk of cross-contamination and transmission of disease between patients and staff. Both the operator and patient need to be protected from communicable diseases, and this is readily achievable with the appropriate use of the correct transducer cover. Thank you.
With over 25 years of experience, Civco is the recognized global specialist in the design, manufacture, and marketing of image-guided solutions for diagnostic and minimally invasive procedures. Civco partners with leading OEMs to supply innovative products such as image-guided needle guidance systems, infection control covers, imaging supplies, and positioning, stabilizing equipment.